Hi, I'm Walt Medlin, and just talking about wounds and post-laparoscopic gastric bypass or sleeve gastrectomy surgery. We get a lot of phone calls with patients who are anxious about their wounds, and understandably so. Sometimes I think they get themselves very worried that they need to call in if they're having any fluid or any redness, and usually, as it's written in your book, we expect that things are going to take 2 to 4 weeks to really get fully healed, and a lot of times these wounds are going to be opened up even a quarter or half an inch, and a fair amount of fluid is going to come out. Usually it's straw-colored fluid early on with a little blood tinge or sometimes even a little brown, and then later there's a little bit of kind of snotty gunk. I hate to be too medical with you, but it's fibrinous material that does look a little bit like what people think of as pus, but if it's a small amount, like you would have it underneath a scab or in any wound, it is usually not an infection unless there's really spreading redness more than an inch around the edges of the wound. So, I start to really be concerned, start antibiotics when it's more than an inch around the edges of one particular wound, or worsening, or getting real tender or hot, or if there's a large amount of like split pea soup looking debris coming out. But usually what people have is less than a marble or 2 marbles worth of, a cubic centimeter of fluid, that gunky fluid, even once over a course of 24 hours. Now the straw-colored fluid can be a lot more than that. People ask us about using ointment, and that usually is fine. Triple antibiotic ointment is not a problem at all, but you don't have to use it. I prefer to keep wounds covered, but some people are so adhesive sensitive that it's really better just to leave them open if the tape is worse problem than the wounds, or better yet, to put gauze under your clothes and wear some tights just to hold the gauze without having to use the adhesive. People worry a lot about movement restrictions or that they're doing something wrong, and I've really never seen anybody create a hernia by neglect or by doing too much. Now, I certainly don't want you to go out and do high-impact activities for that first 2 to 4 weeks, but if you have to do something a little more heavy-duty, again, it's mainly going to cause you pain, and I don't want you to have unnecessary pain. But don't feel terribly restricted or like you're going to do something awful by going up or down stairs or getting in and out of a tall bed or picking up a child. It's more of a pain control issue than worry that you're going to create a problem. I hope that's helpful, and I hope it saves you middle-of-the-night concern, which is always a very lonely time in those that first month after surgery.